Question 61. A nurse is assigned to care for patients with small that need to be placed on airborne precaution. Which of the following items should be used before entering the patient room? A. Glove and gown. B. Glove and goggles. C. Glove and mask. D. Gloves, gown, and 95. The answer is D. Glove, gown, and 95. 62. Which of the following is primary level of prevention? A. Detect and treat existing disease. B. Prevent illness or injury occurring. C. Reduce the extent and severity of health problem. D. Minimize disability and restore to prevent function. The answer is B. Prevent illness or injury occurring. Number 63. A nurse is in surgical unit prepare for wound dressing. While she is preparing, she sneezes over the dressing trolley without wearing a face mask. Which of the following is the most appropriate action should the nurse take? A. Set up new sterile field. B. Put on mask and continue working. C. Continue working the most sterile field. D. Replace the equipment she thinks is contaminated. The answer is set up new sterile field. 64. Which of the following is the most effective infection control precaution to prevent nosocomial infection? A. Hand washing before and after patient contact. B. Wearing glove and mask for direct patient care. C. Isolation precaution. D. Broad spectrum antibiotic. The answer is A. Hand washing before and after patient contact. 65. A 16-month-old child is hospitalized in the intensive care unit with multi-resistant sepsis. On the third day, she had explosive diarrhea. A stool sample was sent to laboratory for C. difficile investigation. Which of the following transmission-based precaution is most appropriate? A. Combination airborne and droplet. B. Contact. C. Droplet. D. Airborne. The answer is B. Contact. 66. When planning discharge teaching for patients hospitalized for treatment of the treatment over 30% of the body, nurse knows it is most important to include instruction regarding the loss of large amounts of serum occurring with burn, the resulting loss of immune function. Which of the following instructions should be included? A. Wash hands frequently each day. B. Wear supplemental oxygen at night. C. Wear mask while in public space. D. Take multiple vitamin tablet night. The answer is A. Wash hands frequently each day. A 20-year-old woman is hospitalized with strong and uncontrollable cough and has difficulty breathing while coughing. A doctor writes an order for the patient to be transported from medical surgical department to the radiology department for an X-ray examination. The nurse prepares to transfer the patient and considers standard precaution and additional transmission precaution. Who of the following would be required to wear mask? A. Radiology staff. B. Nurse and patient. C. Patient. D. Nurse. The answer is B. Nurse and patient. Patient returned to the surgical unit from thyroidectomy. The nurse observed that the arousable blood pressure 90/60, heart rate 108 per minute. What immediate action should the nurse take? A. Recheck pulse and blood pressure. B. Administer intravenous fluids as ordered. C. Place client in modified Trendelenburg. D. Assess the back of the neck surgical dressing for bleeding. The answer is D. Assess the back of the neck surgical dressing for bleeding. Complication of thyroidectomy. A. Distension. B. Bleeding. C. Vocal cord injury. The answer is bleeding. A progressive enlargement of multinodular goiter. Tracheal compression including pain at the side of the ear and jaw. Difficulty swallowing, change of the patient breath by compressing the esophagus. There is in otherwise the patient is at risk. What is the preferred treatment? A. Iodine treatment. B. Thyroid hormone treatment. C. Radioactive iodine treatment. D. Surgical resection of abnormal thyroid. The answer is D. Surgical resection of abnormal thyroid. A post-thyroidectomy patient transferred to ward and developed tetany. The nurse suspected that patient has A. Hypokalemia, B. Hypocalcemia, C. Hyponatremia. The answer is B. Hypocalcemia. Nurse Wen is aware that positive Fostic sign indicate A. Hypocalcemia, B. Hyponatremia, C. Hypokalemia, D. Hypermagnesemia. The answer is hypocalcemia. Fill in the blank. A sign hypocalcemia. Carpal spasm can be elicited by compressing the brachial artery with blood pressure cuff for 3 minutes. The answer is Trosi sign. Fill in the blank. A sign of hypocalcemia. A spasm of the facial muscles elicited by tapping the facial nerve just anterior to the ear. The answer is Fostek sign. Patient is being admitted to recovery room following a thyroidectomy. The back of the neck bone is covered with dressing. During the first 15 minutes, the patient started working and having diarrhea. General assessment is performed with special attention given for the high risk for hemorrhage. Where would bleeding most likely occur? A. Stool, B. Vomitus, C. Dressing, D. Back of neck. The answer is back of neck. A 29-year-old man is in surgical ward on his first post-operation thyroidectomy. He appears drowsy, but he is able to respiration by nodding head. He is developing mild restlessness. What is the initial recommended goal of care? A. Monitor vital sign of thyroid storm. B. Assess for bilateral focal fold mobility. C. Monitor for swelling on the neck. D. Monitor for focal cord paralysis. The answer is A. Monitor vital sign of thyroid storm. A nuclear plant experienced leakage, and all involved workers were brought to emergency department for treatment. The medical team prescribed potassium iodide for the worker to block radioactive iodine to be absorbed by an organ in the body. Which of the following organ is the most sensitive to radioactive iodine? A. Brain, B. Lungs, C. Kidney, D. Thyroid. The answer is D. Thyroid. The nurse cared for 60-year-old woman who have history of hypertension, hypothyroidism, and elevated cholesterol level. She takes tablet daily for each of the health problems. The doctor orders routine dual X-ray absorptiometry tests that show decreased bone density. Which medication most likely contributed the test result? A. Statins, B. Antihypertensive, C. Synthetic thyroid hormone, D. Cholesterol absorption inhibitor. The answer is C. Synthetic thyroid hormone. A 36-year-old man has undergone a subtotal thyroidectomy. He is suspected to develop tetany after the surgery. Which of the following symptoms best indicated tetanus? A. Tingling in the fingers. B. Pain in hand and feet. C. Tension on the suture lines. D. Bleeding on the back of the dressing. The answer is A. Tingling in the fingers. The nurse is assessing 50-year-old woman whose thyroid enlarged. A blood sample was collected and an analysis confirmed a diagnosis. TSH 0.12, T3 210, thyroxine T4 normal. A. Thyroidectomy. B. Incision and drainage. C. Polythyroidectomy. D. Adrenalectomy. The answer is A. Thyroidectomy.